Have you ever had a major project, deadline, or goal that drove such intense focus that when you finally reached that finish line, you didn't feel the immense relief you expected? Instead, you had more of a now what moment. This can happen with a big speech at work or the Herculean task of fighting cancer. So, now that you're done with prehab and treatment, let's brainstorm ways how you can thrive in the next phases of survivorship. This is the 8th and final section in our full series on cancer prehabilitation. Feel free to watch these in any order, but in the early ones we covered a general overview of how prehab is structured and the benefits, my plans of attack when seeing different kinds of cancer, with overviews of different cancer types, a deep dive into exercise, nutrition, and the neuropsychiatric pillars of prehabilitation. That last one is pain, sleep, mood, as well as the questions to ask your work and treatment team to let you safely fight cancer on your terms. Now it's time for the exciting question of what do you feel like doing next? Let me guide you through this one.
My name is Dr. Alex Watson, and I get people ready. I'm a double board certified physician in physical medicine rehabilitation and obesity medicine. I take this expertise in metabolic and rehab medicine, and I help patients get ready for major medical procedures. In this series, I'm sharing my best insights for prehabilitation before cancer therapies. I'm also giving away the cancer prehab chapter of my book for free down below. My only minor request is that you give this video a thumbs up and subscribe so you can see when the next video in the series is released.
When it comes to support resources, so what sort of different resources might be beneficial for maintaining your work-life balance here? The first one being employee assistance programs. So some organizations have a really robust employee assistance sort of system. I know we had this in working in a hospital setting, of course, but other organizations might have something along the lines of counseling and support services to take some of the burden of planning and resource identification off your plate, which extends into occupational therapy type resources. So if you're in a job that is a little more demanding physically, or not, honestly, if they have some sort of occupational therapy or occupational health, wellness type of department here that can identify physical resources such as ergonomic chairs or other physically supporting items, see what they can offer you there. Broad cancer support groups may have other workplace kind of navigation services, insights and resources to help you figure out what you don't know. When it comes to things to ask about, organizations like this one here to provide you just with a lay of the land can be very useful. And finally, if it looks like your workplace is not being accommodating when they kind of have to be, then it's worth consulting with legal representation just to get everything that you're kind of entitled as an employee here, having a medical sort of emergency. All right. Back to my favorite world of insurance here. Some things to consider in terms of insurance navigation before you go through prehab and cancer therapies. Just review your policy's coverage, deductibles, out-of-pocket maximums, network providers, everything there to make sure that you're not going to get any bill in the back end. Those sorts of surprises can add another layer of pain and discomfort to the cancer fighting process. They're going to be like dozens of pages sometimes. I'll feed these into maybe one of the large language models and just ask it to summarize certain aspects for me, or, read this, then ask it questions that are very specific. Say, hey, does this cover X, Y, and Z? What happens if I have this problem? Who's in this network? Those sorts of things. I have no skin in the game with those. I have none that I'm going to recommend here because they change by the minute, and I can't vouch for their complete accuracy. So definitely do your own kind of validation of the accuracy of some of the information there. In some cases, supplemental insurance might be beneficial. It's going to be a different story of trying to acquire that after the fact, but there may be other policies you can invest in that end up saving you money on the back end in terms of like Aflac and those sorts of not typical insurance products to make up for lost wages and things like that. If claims get denied, then there are different kind of patient advocate groups that may be able to help you appeal those denials. Just because it was denied doesn't mean it was rightfully denied. Oh boy, can I speak to that one. Unfortunately, a lot of times we may need to appeal some of these ridiculous decisions that insurance companies make. Some of them are arbitrary. Some of them are just a coding error on the part of your medical professional. So just because you suddenly get stuck with a bill doesn't mean that you're actually going to have to be paying that bill. But it does add a little wrinkle of additional homework and headache for you. If your employment status changes, look into Medicare, Medicaid eligibility, because Medicaid, if your income drops a certain point, or if your medical situation helps you qualify for Medicare, you may be able to defer a lot of out-of-pocket costs if you suddenly qualify for these government insurance programs. When it comes to the specifics of your employment options, look into your sick leave policy, short-term disability policy, FMLA benefits. Look into long-term disability benefits if it looks like you're going to be going through an extended treatment period that goes beyond short-term disability timelines. If able, consider reducing your hours versus a complete leave if you need to maintain employment. And then if you get approval for workplace accommodations, be sure to have this in writing. I'm not saying something to try and pull a fast one on you, but it's always good to have it in writing because people forget. And then later, if someone called them out on a decision they made, it's good to have it in writing because they may get defensive and try and rewrite history a little bit. How can you reduce treatment costs? Well, in this country, that's unfortunately a pretty decent consideration. If you're watching this from another country with a socialized type medicine program, congratulations, your bills are probably not your biggest concern right now, and that's a nice place to be. But if you are a patient in the United States, there are certain things you can do to at least minimize costs that you aren't responsible to actually pay. You can get itemized bills from your treatment providers and hospitals, and then just review for errors. 80% of medical bills apparently may have some different billing errors in there, and if that comes back to you, you might be paying for something that you don't actually need to be paying. You can even bring up costs beforehand with your healthcare providers, their billing departments, things like that, and just see, is there some other way of doing this that's going to reduce your out-of-pocket cost? On the back end, you can do payment plans with kind of very low monthly payments extending into perpetuity here. Just because why should you actually have to pay for your own healthcare like this when it's something that's really important? That's an ethical discussion I'll save for another day, another soapbox. In some cases, you might have the opportunity to participate in a clinical trial. So this will give you access to different treatments at reduced or no costs, even if they're not necessarily the experimental treatments. So being part of clinical trials sometimes gives you access to standard of care measures that are covered just because it's part of the rest of the treatment protocol. And so you may not get a benefit from the actual experimental intervention, but the rest of it, you're going to have that benefit at least, and not out-of-pocket costs related to it. For example, maybe to ensure adherence in this study, they provide transportation to and from cancer centers, and meal planning or something like that to go along and support patients receiving this experimental medication. Well, even if you're in the control group and don't get the medication, you at least get the transportation, the meal planning, all that stuff. So those are ways of potentially getting some benefits here without additional cost, even if you don't necessarily get into an experimental treatment group. And then finally, tax implications. So keep track of your medical expenses. They would potentially qualify for tax deductions. I am not a tax attorney, so definitely look into this stuff with your own accountant. You might be able to get tax credits for after you qualify for disability or for your caregivers. If you're going to withdraw from retirement accounts to pay for medical bills, understand the tax implications of those things. So different considerations to have in mind here. Again, not exhaustive, but at least get you on the right track in terms of thinking of what sort of things should I start looking into to be sure that you're not missing out on ways of saving money or at least deferring unnecessary expenses later. Okay, time for another dizzying change of scenery here, but let's continue our financial support resources discussion. So I kind of touched on this one actually earlier by accident. But the next subcategory here will be the healthcare facility resources, meaning you can approach the hospital and discuss different ways of getting on a payment plan, those sorts of things. So that starts with hospital financial counselors. They can walk you through your either bill or suspected bill or projected bill or whatever they want to call it. Work with your kind of financial situation and recommend different ways of either maybe different insurances you may qualify for in this case. Sometimes we will, when I worked on the inpatient side, we'd get folks set up with Medicaid or Medicare if they qualified, or at least start that paperwork so they can ultimately get their resources covered with less out-of-pocket costs for them. Within this, there will be the social work departments, as we talked about earlier. They just have a better idea of the lay of the land when it comes to programs outside the hospital, and they can connect you with them, support groups, that sort of thing. So one last piece about the payment plans here, and this is likely state dependent because there's a specific way of doing this in Delaware where I'm based. they typically have caps on how much the hospital will make you pay per month. In Delaware, it looks like it's about 5% of your gross income for the month. And so really keeps it reasonable, and you can basically tell them, I'll give you $10 and go away from me. Not literally, but close to it. And this way you're not going to waste your, budgeted money for something that should not be an out-of-pocket cost, like life-saving healthcare. My soapbox. So moving on to medication assistance plans. So there's actually the medication assistance tool, which is put out by the group Pharma, PHRMA. And this tool is actually a search engine that lets you find different potential programs based on the medication and the manufacturer of the medications. So then you just type the medication into the search engine here, and they'll let you know what programs these manufacturers might have so you can afford the medications that you need. And then there are other programs like Needy Meds and GoodRx, and these can be kind of discount programs. Some pharmacies, if you're going to be paying, cash prices, will automatically run a GoodRx for you. Now, if your physician prescribes something like modafinil for wakefulness promoting, I know I've done this for some of my patients as they fight cancer just because of that cancer fatigue. Some insurers, most insurers, don't consider this an approved treatment for it, and so they won't cover it. Not a big deal until you're trying to go to certain pharmacies that don't do GoodRx for controlled substances. Why modafinil is a controlled substance? I know that Rite Aid for sure, as a chain, will let you do this. I think CVS is one of the ones that doesn't let you do this. So I don't mind shouting out CVS for this little annoying feature because it's ridiculous and kind of BS. Okay, now there are some national organizations that can provide financial assistance as well and other resources. So, as an example, the American Cancer Society can provide transportation assistance and lodging for treatments. Cancer Care will provide some limited financial grant type programs. The Patient Advocate Foundation has copay assistance. And then the Leukemia and Lymphoma Society has some disease-specific assistance. So based on whichever kind of diagnosis you have, might have different programs. And now, kind of our last general resources and support groups here. So there are going to be other groups, often cancer organizations, that will provide different kind of core support programs. You'll know what I mean when I get into these. So the American Cancer Society, they have all kinds of kind of peer support, both in person and virtual. They have a 24/7 helpline here. I'll put the number up there and I'll read it just in case you're listening to this. That's going to be 800-227-2345. That is very memorable. I just realized it's 2345. Nice and easy. They've got some particularly well-established programs like their Reach to Recovery and their Cancer Survivors Network. Cancer Care, they provide both online and telephone-based peer support programs, so a nice way to kind of get around any of the logistical issues, or if you're immunocompromised, being able to still maintain good support from peers. It's a great opportunity. And then there's specialized groups that Cancer Care offers will offer different topics that are specific to bereavement, caregiving, as well as kind of specific cancers as well. The Cancer Support Community is its own group, and they have a nationwide network of 175 different locations, and then also their online support communities as well. They have this My Lifeline portal pathway platform, and they can connect patients both with local support and as well as online support. So it's a really great way of not having to go through just Google search and finding random things and hoping to connect with a support group in your community and you show up and no one's there. Fake scenarios, either way. These are tried and true and can be quite helpful. The National Cancer Institute, they have a general cancer information service. The phone number for that one is 1-800-422-6237. And they'll be able to give you kind of specific support resources based on location and cancer type. The Cancer Hope Network, they'll match patients with trained volunteers who are survivors and have kind of shared experiences. And so you feel someone kind of more akin to your experience of what you're going through and kind of your place in all this. And then there are, of course, large-scale cancer-specific groups such as Susan G. Komen, that's going to be for breast cancer, the Leukemia and Lymphoma Society, guess which one that one's for, Prostate Cancer Foundation, and your Colorectal Cancer Alliance. So these being some of the biggest cancer types, or in the case of leukemia and lymphoma, a nice kind of all-encompassing umbrella there, can give you very specific support group directories. And this way, unlike some of the other general support groups, if you're really interested in having someone that's gone through your specific cancer treatment program, you're going to be more likely to have someone in that camp here. All right. This is my favorite part of the talk because we can let the hair down a little bit, because we're talking about survivorship transition planning. So just as a metaphorical, hey, we're out of the rough stuff here. I'm going to take my tie off. Also 6 p.m. here, so the other reason I'm taking the tie off. But either way, you're at the point now where you've gone through treatment, you're in remission, or not necessarily remission, but you're at a point where you have stopped active treatment, and what's next? So your considerations are going to be, how do you maintain some of the benefits you've obtained from prehab? And then also, what does surveillance look like? Kind of late effect prevention, monitoring. How are you getting back to work? What is life after cancer treatment and cancer survivorship? So the first one is, if you weren't big into exercise before all this, and all of a sudden now you've developed a habit of, high intensity interval training, or you developed a love for deadlifting, as some may share this love with you. Either way, keep the habit. You've established this one. You've learned some new principles in terms of exercise and nutrition. In my personal practice, we kind of transition our focus from prehabilitation for X, Y, and Z to prehab for life. And what this usually means is set a new goal, right? So instead of having the distinct goal, of course, of just improving your health for the sake of better outcomes, better treatment tolerance during cancer therapies, now it's, have you always wanted to run a marathon? Have you always wanted to go rock climbing? Have you always wanted to just hike, X, Y, and Z mountain? Any of these things. You just fought cancer. Go fight something less scary and enjoy it, What can be a nice challenge that is achievable, or something else that's going to be a less morbid form of a bucket list kind of item here. So what is something that you've always wanted to do, and now that you've got this newfound level of fitness and everything, you're at a higher baseline because you did prehab, where's your goal? Now would be the time to start considering long-term effects of some of the plans. So if you were on a ketogenic diet, is the example I always use, and it did improve your blood sugar, but also worsened your cholesterol, now consider refining that diet a little bit, whether it be, okay, now I'm going to stick with ketogenic diet, but swap more of the saturated fat sources to more unsaturated. That's one option. Or if it's going to be something along the lines of going to a Mediterranean type diet, because that likely has some other general cancer prevention is a strong word, but just general metabolic benefits that, as we know, can reduce your risk factors for other issues later. Things like that. That's one consideration. The other one's going to be, okay, now you don't need to do the very high intensity exercise because you have a much more extended time frame. So what exercise did you like? Which ones were you doing just because it was medicine, essentially? And double down on what you liked. So as I was joking before, if you discovered new love for strength training and want to build a plan around that, well, think about what your new deficits from treatment might be, and keep hammering things that will support you from succumbing to those deficits. If you had neuropathy from some chemotherapy treatment, well, maybe then you're going to start doing deadlifts, squats, those things barefoot, because you're going to develop much better intrinsic foot muscle control and better sensory awareness and those sorts of things. And you can integrate the sensory feedback into your position and balance control. If you'd overcome early frailty, now you've learned how to strength train. Let's continue rebuilding that bone density, because that certainly hasn't had a massive change over the course of 6 weeks or 8 weeks or whatever the timeline was. But you've got momentum in the right direction. And we do know that bone density, you can rebuild that at any age. It just depends on the stimulus and what you're doing for it. So whereas before maybe high protein was to build muscle mass, now focus the high protein and pepper in maybe a little collagen supplements while you're doing heavy weight-bearing exercises to get that collagen, help try and fortify the bones a little better and rebuild that bone density a bit more. That's the kind of strategy you want to have, and that's going to be very personal decision. But in this case, it's like flipping through a catalog and deciding what cool superpower you're going to develop, what new strength, what new balance, what new whatever is going to take you to your next goal, and how fulfilling can that be for you? Surveillance programs, that just means how often are you going for testing to make sure that if you did achieve remission, that you remain in remission. Um, these can be nerve wracking. So if you had a high risk kind of cancer where surveillance is going to be particularly nerve wracking for you, not that any of them are not, but maybe find a buddy, support group, somebody that with whom you can be, sharing the experience, can provide some support, or some sort of more professional support in this case too, whether that be a psychologist or someone that can help you unpack the journey you've just been through, but what survivorship really means in terms of, always feeling that sword of Damocles is over your head here, and when that gonna, um, you know, fall. The amount of physicians and therapists and et cetera who get psychological and psychiatric help just to get through some of their experiences, even those who know the tools still need a third party individual to help them utilize those tools. So in this case, it is very reasonable and beneficial to continue to work through these things, even if you've gotten through the woods. There is a traumatizing effect of being faced with that mortality. So even if you've achieved remission, it may be worth considering ongoing psychological support. Now, there's the idea of late effect prevention and monitoring. So late effect means it's a side effect of treatment that doesn't occur immediately. Intuitive. The one that I was exposed to the most during my training is an effect of radiation therapies. So radiation therapies, very, very necessary in many cases of cancer. However, they have a few known negative effects. And these are going to be particularly potential raising the risk for other cancers and adjacent tissues. Also, plexopathies. So in your body, you have two main plexuses, brachial plexus and the lumbosacral plexus down in your hip area. And what these are is when the nerves are leaving your spine, they need to, these are, nerve roots, spinal roots, whatever. They need to, kind of crisscross, mix and match some fibers to create all the peripheral nerves in your arm. So it leaves your neck, C5 through T1 or so. T1 not your neck, it's thoracic. But they need to become the median ulnar radial nerves, yada yada yada. And so that's where the brachial plexus comes in handy. If you look this up on Google Images, it's the bane of existence for most medical students, residents who go into these kinds of fields, because it is a rite of passage to have pages and pages and pages and pages and pages and pages in your notebooks of the brachial plexus drawn over and over and over. That becomes a challenge to see who can draw the fastest and all the kinds of nerd fun that we had. But it's important because when you have radiation, I see this a lot in the lumbosacral plexus with prostate radiation. I mean, it's beams, not pellets, or radiation for things like cervical cancer, where the radiation causes a plexopathy that's very distinct to radiation. So there are other kinds of plexopathies that can happen just from, falling out of a tree and catching your arm branch. That's a very common boards question. But in this case, this type of plexopathy presents with painless loss of sensation and then other neurologic effects. The reason why is you get fibrosis around the plexus that kind of distorts the nerves. And nerves don't like being twisted and pulled and all that kind of stuff, and compressed. So that's one thing that may happen years later. About 10 years or so is typical in this case. But it's really important to know about this because I had a case relatively recently where it was a gentleman who'd had decreased sensation and a weakness in his legs. So the well-intentioned surgeons that he saw first decompressed his spine, his lumbar spine. Then, when it didn't work, said the neck. So they decompressed it, didn't work again. They said, oh, a different part of the spine. So he did a third spine surgery. Shockingly, none of these worked because the problem wasn't his spine at all. In fact, he'd had an EMG that showed subtle signs that it may actually have been a plexopathy. And so um, I tell the story not to mock, but instead to explain how easily missed something like this can be if someone doesn't A, take a thorough history, B, take a really thorough history, understand what the treatments actually were for prostate cancer in this case, um, but then C, also think about what, also just understand that this should be on their radar. So even do a good history, if your brain's not tuned to consider plexopathy as a case of this kind of, that's why the history that was taken probably didn't include beam radiation to the pelvic area. Um, Things like that. Lymphedema can happen with a bit of a delay, which is why it's really good to just maintain activity in the arm that had the axial dissection, or in the legs if you've had pelvic lymph node dissections, to keep that external pump muscles to keep fluid out of the limb. Understanding, I think I mentioned this earlier, but understanding what restrictions exist and don't exist for a limb that's had a lymph node dissection. So no longer are we saying that limb is just for decoration, and actually you can use it still. And this will save your poor other limb from being a pincushion exclusively and double the IV draws and all that stuff. Oh, I'm full of snark today. And then you want to get back to work. If this is your goal, there are ways of reintegrating into the workplace. So obviously meet with HR because that's kind of their job. But there are specific vocational rehab programs. So if your job involves something that is a little more technically difficult, or now you require some assistance because you weakness in your hands or neuropathy so bad that you can't type anymore, so you can get speech to text software or some other kind of accommodations. Vocational rehab will help you with that, and they often have grants and things that help fund those accommodations when you go through them. Okay, and then back if you can, if you're so inclined and feel um, kind of emotionally able to now be a shoulder for somebody else, it's a really fulfilling and rewarding process to be able to look back and see how far you've come, and then be able to help someone else through that journey as well. So it's really, really important to, if you're able to, and this is another one of the don't feel guilty if you can't handle it right now kind of things, but if you can, to be able to help someone else, picture them in the shoes that you were in and the fear you felt and all those things, it'll be very rewarding for you to be able to get back. So consider that if you're able to. In conclusion, this has been a fun and detailed discussion. I hope you've taken something from this. Don't turn off the video. This conclusion has actual points to it. So basically, prehab is a no risk opportunity to potentially improve your treatment outcomes, reduces side effects during and after treatment, and regain that feeling of control. It is a chance for you to get out of the passenger seat and hold that steering wheel and dictate some of your outcomes. It is your chance to meaningfully, you know, develop a future on your terms based on your effort, and have just much more empowered experience throughout the whole thing. Less of people telling you what to do and where to go, and more of you asking informed questions and understanding what's coming and being able to, um, you know, make informed suggestions even as to, hey, I hear this can happen with this kind of chemotherapy. Is there potential for, you know, this sort of preventative maneuver? Or, hey, can we focus more on arm strengthening because I'm worried about lymphedema after this. I already have a little bit of swelling in my limbs, and yeah, I'd like to really build a lot of biceps, triceps, and forearm strength to be able to help to kind of wring the fluid out of the limb. It gives you the chance to have agency in your outcomes. But I don't want to oversell it. I don't want to add guilt. I want you to be able to take from this whatever you'd like and make your outcomes on your terms. But also know that if all you're capable of doing at this moment, taking this information in and just learning about it, you're already doing something positive for yourself. You're already, getting informed as to what the process might be like, and that alone will give you better outcomes because you'll feel less surprised by certain steps of the way, or your head won't be spinning when you're meeting the 13th person on the team and
all of a sudden now you know how the occupational therapist improve your life, or why there's a respiratory therapist and a speech therapist and a psychologist and a neuropsychologist. These sorts of things, um, when you have your feet under you, just makes the experience a lot less dehumanizing and a lot better of an experience for you. So I can leave you with one piece of parting wisdom. It is to start prehab as soon as you feel comfortable. Ideally, the second you are diagnosed, you feel ready to go. But if not, understand that this is your time on your terms. So when you feel ready, get started. At the bottom here, we've got a link to a checklist of general cancer prehabilitation readiness, things that you may want to just keep track of, things to consider asking about, or other means of, again, just having a roadmap of what can dictate your best outcomes. Totally free. Click this link, and I hope that it helps you. We're also going to be coming out with other different prehab related topics like this. Plans will be for something related to bariatric surgery and medical weight loss. So it'll be prehab for bariatric surgery, but basically a medical weight loss course in and of itself for those, even if they're not going to surgery. We'll be doing joint replacements and spine surgeries. Basically, I'm taking the entire book, this one, and going to be making courses out of each section here. If you are somebody who has a little bit of medical background and wants to instead actually learn this from the prehab clinician side of things, underneath that first link is going to be another link to a course that we put together where you get to listen to me rant about this stuff from the provider side of things. Teaching you how to set up a prehab clinic, both the billing things, logistical things, the techniques you want to learn and teach. A lot of what we talked about here, but instead a lot more jargony, but deeper insights that I wouldn't bore the non-clinical person with and overwhelm them, because it won't add as much benefit to someone unless they're going to be applying those sorts of concepts into a clinical setting. Last thing I ask of you, please subscribe and like this video, just because we worked really hard on this one and I want to be able to reach as many people as it can help. And that's why we're giving this one out for free. So if you're able to, all I ask of you for the support in this one, please make it available for other people. I want to be able to help anyone that we can with this information. So again, I'm Dr. Alex Watson, and I got you ready. See you next time. Thank you.